when I entered, Sister Mary Anthony, our postulant director, asked me what I would like to be. And I said, not a teacher. She said, well, we'll pray about that. And because I don't know if they saw a little bent of nursing in me or something, Mother Ricarda asked me to go to St. Raphael's. And I went, what's that? And she said, on your legs, you know, we could write out what we would like to do. You said something about St. Paul Orphanage, and I knew that didn't belong to us, but I thought, well, who knows? And she said, I'd like to have you take care of the elderly at St. Raphael's. They need many of the things that a younger child needs, and it's true. And she sent me there, and I loved it. And I loved nursing immediately. And when I was there 3.5 years, she came and she said, I understand you're doing very well. We would like to send you to get your LPN in Rochester. And I almost jumped out of the chair. I was so excited because I knew by that time nursing was in my blood. I knew it was my passion already, so. And then I was an LPN for 17 years, and the St. Cloud Hospital School of Nursing offered a program for those of us that had some years of experience to take the program in 2 years. And because as an LPN you don't have anatomy and physiology, I took that one summer and loved every bit of it. And then I finished in 76.
With an RN.
Yeah.
Mm-hmm.
And was put on 2 North. And that winter, my head nurse kept saying, Juliana, we have to get you started in taking charge nurse position. In nursing homes, you took charge of everything when you were in charge of a floor. I mean, you were just expected to be in charge. And I said, anytime, Jean. And then all of a sudden I get this call from our personnel director saying, I've got a problem. And it was 10 o'clock on a Friday night. And I said, what is your problem? And she said, the nurse at St. Joseph's Home, which we were closing in a year, resigned, and the residents and the sisters over at St. Joseph's Home want you back there. I'd been there for 12 years. Didn't like it at first at all because I loved St. Raphael's and got to love it. St. Raphael's was closer downtown. I guess I liked the activity part. I'd been there for 10 years. And then I was asked to come to St. Joseph's Home. And I didn't like it initially, but then they were going to start a new nursing unit because otherwise we wouldn't be able to be relicensed. And Sister Benedict said, I want you to start it. Set it up, buy anything you need. So then I got that started. And then of course you get so engrossed in it that you get to like it. You really get to know the patient. And I got to know the families very well. And I wanted them to get the best possible care. I wanted to eliminate that name that nursing homes had for years as a place to die. I just didn't think that a nursing home should have that name. And I knew we were well loved in nursing homes, in St. Joseph's Home and St. Raphael's, because we always had a waiting list. Always had a waiting list. We would have 5 and 6 individuals from one family, you know, like uncle, aunt, grandma, grandpa. And one day our state inspector said, Sister Juliana, do you know what that says about this place? And I said, I think it means we're doing the right thing. And she said, you're right. Keep it up. And I had I hold myself to a high standard, and I kind of did the same thing for the employees that worked for us. And I knew we gave good care. St. Raphael's was closed in 75. We really needed the area for our sisters because some very elderly sisters and some others were living at St. Cloud Hospital Convent. And we felt that St. Raphael's would afford a more, monastic site, etc. And so many of those sisters that were at the convent were not working there. And besides, the state was getting stiffer with their regulations. We would have had to do, I don't know, to keep that up. And then at St. Joseph's Home, kind of the same thing. The demands they were putting on us. And we knew, because the infirmary, what used to be up here, we knew that we would need to set aside a place for our sisters so that we could offer nursing care to our sisters. So that's why plans were made to close that down. And then they wanted a building that would be equal to the beds of St. Raphael's and St. Joseph's Home. I think St. Raphael's was like 85 when they closed, and we were 104. Now at St. Joseph's Home, 26 were nursing beds. About 25 were what we call ICF, intermediate care, on first floor. Second and third were more boarding care. You know, some of those people were there like 20 years.
Wow.
And they loved it.
Yeah.
They loved it. And it was difficult for them to move, but we took as many as we could for open house over to St. Benedict Center, and then we moved the furniture and the clothing the day before. We double scheduled people, staff, the day before, the day of, and the day after. It was a challenge, but we felt that that was the most important. If we would give that a good beginning, then it would go better.
Okay.
And I know it did. That really helped. And like one of the men up on third floor, the night before we moved, I came up to third floor and they were playing cards, and they could keep liquor in their room, but it would have to be stored in the pantry and stuff on the floors. And there, each one had a bottle of beer, and they were playing cards. And I said, well, you certainly are enjoying your last night here. And this one guy said, well, sister, you know the most important thing is going with us. And I said, what's that meant? He said, you people. He said, everything else doesn't matter. The wisdom of the ages.